Femoral triangle first. So what are the borders? Superior border is inguinal ligament. Good. Lateral border is sartorius. Good. Okay. And the medial border is, what's this muscle here? Adductor longus. I'll do my best. Okay. There's a lot of extra noise too. So, all right. Adductor longus. Good. Okay. Next to adductor longus on the floor is the pectineus. All right. And next to pectineus over here is going to be the tendon of the iliopsoas. Okay? Now, in the triangle, contents from lateral to medial are navel, right? So the first thing you should see is the femoral nerve. All right? And what you're going to see when the femoral nerve comes deep to the inguinal ligament is it's immediately going to split, right? Okay, and you're going to see all sorts of branches. So here's a branch of it. You're going to see lots of different muscular branches, all right? You're also going to see out there cutaneous branches, all right? Cutaneous branches go where? To the skin. Skin? Awesome. What part of the skin? To the
anterior medial?
Yes, anterior and medial thigh, right? Okay, because lateral thigh is
Lateral femoral cutaneous.
Lateral femoral cutaneous, good, and the upper part of the medial thigh is obturator. Awesome. Okay, good. All right, so that's the nerve. Then we have the femoral artery. Good. And the femoral artery, almost very quickly here, is going to split. It's going to give off a major branch called the deep femoral or profunda femoral. Good. And off the profunda femoral, to the lateral side is the lateral circumflex femoral. All right. And the lateral circumflex femoral is going to have how many branches? 3. And so this one looks like there's an ascending here. All right, ascending, where's that ascending heading towards? Towards greater trochanter, and it's going to help participate in that collateral circulation of the hip joint. Okay, good. And then there's going to be a transverse branch, all right, going this way, and then there should be a descending branch. All right, and that descending branch will go all the way down to the collateral circulation of the knee. Okay, good. On the other side, and I'm not sure if you can see this in the video or not, but there should be a medial circumflex femoral. All right, and the medial circumflex femoral, you're going to know it comes off the deep femoral. Ways to help you identify it are it's coming off the deep femoral, and it's piercing between 2 muscles. All right. Should go between the iliopsoas and the pectineus. All right, so this one needs to be cleaned out a little bit more so you can actually see the iliopsoas. But here's pectineus, all right, but you see it diving deep between those 2. Okay, all right. Then in there, so we've got nerve, artery. Then we should have vein. All right, and here's the femoral vein. All right, and then this vein that's coming up and going into the femoral vein, that's our greater saphenous, right? Remember there's 2 saphenuses, greater and lesser, right? So that's the greater saphenous vein. Okay? Good. And then what should come next? Empty space and then some lymph. And so they've removed the lymph nodes. Okay? So that's the femoral triangle. All right? Let's follow that femoral artery a little bit further down. All right? It's going to go through the femoral triangle, and then it's going to go through the before it goes through that adductor hiatus, it goes in that subsartorial canal, right? So this is the sartorius, good, all right. And you see the artery here deep to it, okay? And traveling with it is a branch of the femoral nerve, all right? And that branch of the femoral nerve has a name, all right? And what's going to happen down here is the femoral artery is going to go through that adductor hiatus, but that's way down here, way distally, okay? Once it goes through the adductor hiatus, then we call it what? Popliteal artery, right? Good, okay? And that named nerve that travels along with the femoral artery in that subsartorial canal, but doesn't go through the adductor hiatus, continues on down to the medial part of the leg. What is it? Saphenous nerve, okay? So if you were to dissect this out, you'd see that the artery goes through the canal, saphenous nerve continues on down.
So
right?
the saphenous is muscular in the top?
No. when it comes out, boom, right? Okay. So the main trunk of the femoral is going to split. There's going to be all sorts of muscular branches, but the saphenous will come off there also. Okay. So saphenous will stay cutaneous. It just travels in the thigh. It doesn't do anything in the thigh. All right. And it's only when it crosses the knee that it becomes cutaneous, or it actually begins to work. Yeah. Okay. And that it's just traveling through the thigh. Okay. So these other branches up here, there's some other muscular branches up there. Okay? All right? So this is sartorius. Other muscles in that anterior compartment, these are all part of the quadriceps. So this one is the rectus femoris. Okay? And if we were to remove some of the fascia here, you'd see that it attaches to what? Sartorius attaches to the ASIS. Rectus femoris attaches to the AIIS. Good. Okay? Then this would be vastus medialis, all right? Then vastus intermedius, and finally vastus lateralis. Very good, okay? In the medial compartment, we already talked about pectineus, adductor longus. Over here is gracilis, good. Deep to adductor longus should be this one isn't quite dissected, but it should be adductor brevis. And then this big guy here that the femoral artery is going through, that's the adductor magnus. Okay, so in this one they need to find the brevis. Okay, all right, so that's the anterior thigh. This one is, what's this guy over here that's attaching into the IT band? That's TFL. Okay, all right, so that's your tensor fasciolata that's attaching into that. Their IT band is a little bit attached to their skin. Okay? All right? Cool. All right, you can take that off.